Update, I'm Kim Hicks Dye. Chances are this has happened to you. You get sick, you get prescription drugs, then you get well, and you put those drugs in a drawer and forget about it. Well, my guests today are encouraging you to safely dispose of your drugs, and they're going to tell you how. Joining me right now is our own Julie Muster-Bryson, and also Dr. James Bridgers, who is the Acting Health Officer for Charles County. Welcome.
Thank you for having us.
Thank you for having us.
I'm going to start with you. Tell us, first of all about the Drug Take Back program, how it works, because some folks may not have heard of it.
Well, it's a very exciting program that started in FY16. Our Board of County Commissioners initiated this program, and we're the first county in the state of Maryland to have it outside of law enforcement. Our Drug Take Back program has 7 independent small business pharmacies in Charles County, and they have a large blue receptacle, similar to a post office box, that's in their pharmacy. You go in, you take your medications, you drop them in, no one should stop you, ask you questions, and you've safely disposed of any medication that you might have that's outdated, no longer needed, and needs to be safely disposed of.
And this is free.
And this is a free service, free confidential service. Yes, ma'am.
So tell us, Dr. Bridges, is it working?
It is absolutely working, Kim. The numbers, the fatal overdoses for Charles County has decreased by 18% from FY or 2016 to currently. The Drug Take Back program, in addition to drug disposable pouches that we have at the health department, are significantly deterring people from misusing and abusing and diverting drugs in the community. So yes, it is absolutely working.
Now you have something in your hand. Tell us about that. Say you can't get to a pharmacy.
Sure.
There's another option, right?
Sure. There's another option. We have distributed these drug deactivation system pouches in the community. And the way it works is you tear open the pouch, you can pour in 45 pills, 6 ounces of liquid, or 4 patches. You add warm water, let sit for 30 seconds. And the strength behind this is that, as you said before, you may not be able to get to a disposal receptacle or an agency where there's a drug disposable application. And so what you can do is you can just discard your old unwanted drugs here, wait 30 seconds, and then throw them in the trash can. They are environmental friendly. You don't have to worry about contaminating the ecosystem, the waterways, and it is an alternative strategy. You touched on briefly about having drugs and having family members in the drawer, in the cabinet. This is a safe way to dispose of those unwanted drugs. You know, we have those old pain medicines and cough syrups and nicotine patches that folks come over, and unbeknownst to you, they may want to explore your medicine cabinet, if you will. So if you can't physically get to a place where you can dispose of those drugs, you can use the patches. We received over 5,000 patches from the Maryland Department of Health, and we've distributed 2,750 of these pouches in the community. We've given them to EMS, the Department of Social Services, our nurses in the school system have them, our agency has them, and we still have some available to the community. So if you would like to get a pouch, or maybe 2, because there are limited numbers, you can dial 301-609-6631, and someone in our behavioral health department, specifically our substance use disorder division, will make these pouches available. So again, it is absolutely working, but we still have work to do. We still need you to dispose of those unwanted drugs. We still need you to, if you can't dispose of those unwanted drugs, call the health department or partner agency. The sheriff's office has them. And we're even going to place some in the county building for individuals to have. So we want to get it out in the community. We want to educate folks, as we talked about and as we're doing now, to let them know how safe it is, how we're trying to make it convenient for them, and how it is an absolute necessity to get unwanted drugs off the streets, but more importantly, out of your home.
Out of your home, because a lot of people don't believe that, folks really do come into your house and do that as well. Ms. Bryson, I know you have some numbers too when you talk about the drug take back program.
We collected a little bit over 1,200 pounds in our very first year, but last year we collected 2,225 pounds using our drug take back program. We collected an additional 90 pounds from our DEA drug take back day that we did last year. And so this year we have another DEA drug take back day. And that's on October 27th from 10 a.m. until 2 p.m. here in the county government building. All you have to do is drive up and you can dispose of your drugs safely there. And we will then make sure that they're securely disposed of.
Now, what is, it's a feather in Charles County government's cap too, because why? Tell us about that.
So we are one of the few non-law enforcement agencies that actually participate in the Drug Enforcement Agency Drug Take Back Day. And that, again, because of our Drug Take Back program that's so unique to Charles County, and our emergency services personnel help us to make that happen, and our security personnel. It's definitely a team effort, and we're looking forward to double our numbers in October for that one particular day. And we're looking upwards of collecting 3,000 pounds in FY19.
A lot of drugs that will no longer, get into the wrong hands.
That's absolutely correct.
You're talking about a real community problem and a community effort, right? Tell us about September. What is September?
September is Recovery Month, and you are a voice, Kim. Julie, you are a voice, and I am a voice. This is the t-shirt that we wear to celebrate Recovery Month. Prevention works, and people recover. So as part of our prevention strategy, partnered with the county, the drug take-back program, the drug disposal pouches, all of this falls into our approach to preventing folks who may not want to use drugs, misuse drugs, or even divert drugs in our community. So this is an opportunity for us to help shape our community, to destigmatize the notion that people do not recover. They do recover. Prevention works, and September is the month to celebrate recovery.
Excellent, excellent. Let's talk a little bit more with the drug take back and the participating pharmacies. It exceeded their expectations, didn't it?
It absolutely has exceeded their expectations. One of our pharmacies has just gone to collection every single month. That means that pharmacy alone is collecting 100 pounds of medication every single month to turn over. We have 2 pharmacies that increase their collection to every other month, and the last 4 then will do it every quarter. We just added our 7th pharmacy, Med-Surg Pharmacy in Bryans Road. They're our 7th pharmacy, and we're on the way to actually adding an 8th pharmacy very, very soon. So we are expanding very quickly, which is great news, because as Dr. Bridger said, this is a community effort. This is the effort of every individual in Charles County to go ahead and get those medications, get them into one of his pouches, get them into one of our receptacles, but let's get them out of the general area that anybody could get their hands on them.
Very, very important. So once again, October 27th, that's Saturday, but lots of other options, right? The pharmacies?
Absolutely. The pharmacies are, their business hours, 7 days a week. There is a pharmacy open that will take your medication.
Excellent. And one more time.
And the drug disposal pouches are available. Contact the Charles County Department of Health.
And I can't close this without, again, you said it, recovery is possible.
Yes, recovery
for somebody
is
that's
possible.
going through this right now, maybe a family member or themselves, please give them hope.
Yes.
What does it take?
Well, it takes a community. And the strength in our discussion today is that it is a partnership. It is a community partnership. The county administration, the sheriff's office, the health department, the hospital, we all work earnestly to reduce the number of drugs, especially opioids, in our community. So help is available. Contact the health department or any other partner agency. I would add one thing is that we have peer recovery specialists in the health department who have an intimate awareness in the community. We thank the county administration for allowing us to increase the number of peer specialists in the community, because they're the ones who actually know. They're in touch. They tell us where the problem areas are, and they actually walk individuals who may have had a non-fatal overdose to the health department or other areas to receive some level of outpatient treatment. So again, the strength is in partnership. We use an asset-based approach, and we're looking at all of the assets collectively in the county to make this a win-win situation, I would say.
Excellent. Well, thank you so much,
Thank
Dr.
you.
Bridgers
Thank you.
and Julie Muster-Bryson, and of course, best of luck on October 27th and beyond, right?
Yes, thank you very much
Thank
for
you
having me.
so much for having me.
And for the folks out there, thank you so much for joining us for this update.